So as I'm sure a lot of you know, cardiovascular disease is one of the biggest killers worldwide. And there's a lot of discussions around cardiovascular disease and the best ways of preventing it. And a lot of that discussion often ends up being around lipids, things like LDL, oxidized LDL, even Lp(a). But there's a new area of research that continues to grow looking at something else that may be a very major causative factor in future cardiovascular disease and heart disease overall. And that's actually micro and nanoplastics. And so we're going to look at this new study that actually looked at micro and nanoplastics inside the carotid artery for those undergoing surgery of removing an underlying plaque. Really interesting study, and it gives us some really good insight into how sort of ubiquitous now microplastics and nanoplastics really are in our environment. And so if you haven't heard of microplastics, or nanoplastics is probably a newer word, then these are these very small, fine particles of plastic that, as I said, are sort of all around the globe now. In fact, we're finding them in the Antarctic. They found them in the Marianas Trench. There's been articles about that recently. And there's also been some newer studies that have shown it in umbilical cord blood, in the blood of humans, in babies, in the placenta, pretty much everywhere. So we basically have an entire environment now where microplastics and nanoplastics are all around us, and it's very hard to avoid them. There are some things that we can do to avoid it, so make sure to stay at the end where we look at those types of things. But first, let's look at the actual study, what they did, and sort of get an idea of how plastics may be a causative factor in underlying cardiovascular disease. So the research that we're looking at is this one here, microplastics and nanoplastics in atheromas and cardiovascular events. And so the big takeaway here is what they found was basically a 5 times greater risk of cardiovascular disease in those who had a significant amount of micro and nanoplastics in these plaques and that they excised from the patients. So quite a significant increased risk. 5 times, it's not something small that we're talking about. It is obviously a marked increase. Of course, now the sort of aspect where the research has to dive into is this causative or is it just correlated? And so we'll look at some of the limitations of the study and a few things they talk about. But before we jump into all of the details, if you haven't heard of micro and nanoplastics before, so microplastics basically defined as anything smaller than 5 millimeters, and nanoplastics are particles smaller than 1,000 nanometers. So very, very small, very, very fine. The problem with these plastics and plastics overall is they don't really degrade. They just break down into smaller and smaller and smaller pieces pretty much infinitely until they're these nanoparticles. And they can be airborne, they can be in the water. There's research to show that they can basically go into the air and go very far distances, hence why it's found in the Antarctic. So they really are ubiquitous, kind of everywhere around. So let's look at what the research actually found. The main takeaway here from the discussion that we can sort of give a high-level overview is among patients with asymptomatic high-grade carotid artery stenosis. So that's the carotid artery where they were looking at these plaques or stenosis, which is a narrowing of the vessel, who are undergoing carotid and arterectomy, very difficult word, which is basically removing of that section of the carotid artery or removing the plaque inside it. Those with evidence of micro and nanoplastics within the carotid plaque had a greater incidence of composite myocardial infarction, heart attacks, stroke, or death from any cause than patients who did not have evidence of these micro and nanoplastics within that atheroma. So that gives us a very good high-level overview. Let's dive into the actual research itself. So what they were looking at, they had 257 participants within the research, aged 18 to 75, so quite a broad range. Obviously, the older we get, the higher our risk of cardiovascular disease, but some people, even young, can still have some signs of plaque and stenosis in that carotid artery. So they were asymptomatic extracranial, meaning outside of the cranium, high-grade internal carotid artery stenosis, as mentioned before, and they were already scheduled to undergo surgery to remove that section of it. They assessed the presence of the plastics from that excised plaque, and they measured it under GCMS, so gas chromatography mass spectrometry. They also did stable isotope analysis and electron microscope. So they really did quite a very in-depth review to look at the micro and nanoplastics within these specimens and samples. So they found plastic particles, mostly nanoparticles, within the plaques of 150 patients. So out of that 257, we're looking at about 58.4% had detectable amounts of specific plastics, polyethylene, within these specimens. And then 31, about 12.1%, also had a measurable amount of polyvinyl chloride, another type of plastics. And they talk about how in a lot of the research in this space now, those are sort of the two main plastic compounds they find. There are other ones that can be found within the body, but those are sort of the two most probable ones. Really nice thing as well with the study is not only did they look at the plaques across all those different measures, they also looked at here the inflammatory markers, which is really interesting because one of the mechanisms they're thinking that these plastics play a role is potentially increasing inflammation, particularly within the endothelium, which can lead to cardiovascular events, can lead to plaque, etc. And so they looked at various different interleukins. So we can see there's a marginal increase in some interleukins across here, TNF alpha, interleukin 18, etc. They also looked at potential collagen within it. So we can see that those who have micro and nanoplastics actually had less collagen content. So thereby potentially making the endothelium and the vessel less resilient and more susceptible to damage and things of that nature. And they also looked at measures for influx of white blood cells, so macrophages and those types of things, which are required in the development of a plaque. And that's where we can probably see a little bit more significant. So we see CD3 and CD68, which are two particular markers for those white blood cells. So we can see a general trend where there are higher levels of these signs of inflammation, which is, as I said, one of the things that they think might be the cause of why it's increasing this risk. What was good with this study, it was prospective, and they followed them over 34 months. So it was a pretty good amount of time. And then they just followed up to see how many events they potentially had, keeping in mind the age range. So what they found is at follow-up, they had non-fatal heart attack, non-fatal stroke, and death from any cause occurred in about 20% of the patients who had the plastics and only about 7.5% who didn't have any detectable plastics. So that was a significant difference between those two groups, which can suggest that there's some correlation between finding these plastics in the atheromas and not having it. And of course, this is correlation. We don't have very clear evidence because we don't have RCTs yet to suggest that it's causative, but the data is probably pretty strong to show that it's creating some potential inflammation and thereby potentially causative. And if I was a betting man, I'd probably say that having plastic in your arteries is probably going to be causative of some potential increased risk of disease. What was good is they also did adjust for age, sex, body mass, and health conditions such as diabetes and abnormal cholesterol. And after they adjusted for all of those, as we said in the main findings, they had a nearly 5 times greater risk of cardiovascular events in the patients with the detectable plastics. So again, very significant difference between those. As I said, the sort of mechanism they were talking about here is that there seems to be a promotion of oxidative stress and inflammation and even apoptosis. So that's where some of the cells potentially die within the endothelium and within other vascular cells, obviously then leading to potential plaques, damage to that lining, which is sort of the earlier stages, which can then lead to plaque. So they do suggest there's a potential causative role of those micro and nanoplastics leading to all of these issues. Now, a couple limitations of this study. As I said, this was a prospective observational study. It's not a randomized controlled trial. So, take that with a grain of salt. It does mean causative. We can't necessarily determine causation, mostly just correlative. They also did mention that this study wasn't done in a clean room, and so there's a potential that there could have been contaminated specimens when they're actually looking at them under the microscope or putting them through testing, because there are plastics all around in the environment, including in their lab. The chances of that and the likelihood of that are probably quite low, given the significant difference between the groups, but it is still a limitation. They also didn't measure socioeconomic class. And so we have to take that into consideration, that there could be other things that we haven't thought of, where maybe those who are more exposed to plastics are also living in poverty, or they have generally unhealthy lifestyles, something else where there could be another bias that we're not aware of. But this does add to a growing amount of other data that has corroborated these findings, showing plastics within the body that may lead to potential issues. So that's a general overview of the study. So main takeaway here is plastics are being found sort of everywhere, and it can be an aspect of cardiovascular disease risk, quite a significant one, 5 times the fold. So what can we do? Obviously, we can't eliminate everything in our environment, but we can do our best to minimize certain things. Obviously, we want to try to eliminate plastic anywhere and everywhere we can, particularly in your food. One of the major things that people are exposed to is drinking cups, especially for coffee. So if you're getting a coffee with that lid, then you're going to get exposed to the plastics there, especially because it's a hot substance and a lot of those plastics and compounds can leach into it. So try to avoid plastic anywhere across your food and water. Personal care products, things like makeup, creams, those types of things can also be sources, and even your clothing. So any sort of synthetic fibers may have some exposures as well. Outside of those, the two biggest things are going to be air pollution and water. So always make sure that you're filtering your water with a really high quality water filter, even if it's just like a Brita filter or something simple. The highest level is going to be something like a reverse osmosis water filter. That's going to remove everything, including minerals. So you want to make sure you put those back in. And then inside your home, it's always good to make sure you keep the windows open so you're getting circulation throughout the house, or even look at using an air purifying system that pulls out a lot of things out of the air. Because even, as we said, a lot of those particles, when they're that small, when they're nanoparticles, they can just be sort of flying through the air. So anything we can do to minimize those is going to be the best thing. And then, following your usual sort of screening and testing for cardiovascular disease. So that's going to be things like measuring your ApoB, your ApoA, homocysteine, making sure your blood pressure is good, maybe even doing something like pulse wave analysis. You can do more investigations, such as a carotid intermediate thickness, so they can actually scan and see if there's any thickening in that carotid artery, or doing things like a calcium score or a CT angiogram. If you're doing all of that and generally living a pretty healthy lifestyle, then you're doing the best thing that you can to minimize those plastics. Don't get overly worried about what you're exposed to in the environment, because we can't eliminate everything, but we want to do the best that we can to minimize these. And I think the number one thing is trying to eliminate as many plastics out of your lifestyle as you can. So that's sort of the main points. Take that with us. Obviously, one of the main things for longevity and living a healthy life is making sure we don't get cardiovascular disease. And so this just adds a little bit more research into the plastics. If these are things that you want to dive into, if you have any more questions, you can work with me. You can see the links below, and you can always support my channel by liking, following, and subscribing, as that really helps out. All right, we'll see you guys in the next one.